You're listening to the Exploring Fitness Podcast, episode 13. This episode takes a deep dive into an area that often doesn't get enough attention but impacts so many aspects of physical performance, recovery, and overall quality of life. In 3, 2, 1, go. I'm Dan Dalator. In over 10 years of experience as a clinician and a coach, I've worked with hundreds of athletes to help them improve their health, wellness, and fitness, but still feel that there is so much more for all of us to learn. This is a podcast dedicated to furthering our understanding of health, wellness, fitness, and how to apply these concepts into our daily lives to create true and lasting changes in your fitness and health. This is the Exploring Fitness Podcast. Many people don't realize just how integral pelvic health is to our core stability, athletic performance, and daily life. And before all the dudes out there turn this off or think this episode doesn't apply to you, think again. We often hear pelvic health considerations geared towards women, especially around pregnancy or postpartum. But men are also impacted by pelvic health issues every day. For athletes and fitness enthusiasts, a strong pelvic core is key to core strength, balance, and proper breathing. Pelvic health issues are incredibly common, yet many people aren't sure when it's the right time to seek help. Enter my next guest. I invited her onto the podcast to have a conversation about the issues both men and women face when it comes to pelvic health and fitness. And while some might feel uncomfortable discussing some of these issues, she makes it incredibly easy. All right. Hey, everybody. Welcome back for another episode. My guest today has been a doctor of physical therapy for over 10 years, spending 7 of those 10 years dedicated to pelvic floor physical therapy, where she treats men and women with pelvic floor conditions. She has her pelvic rehabilitation certification and hopes to become a board-certified women's health clinical specialist in the near future. And most recently, she began seeing pelvic health patients for infinite capacity physical therapy to better help active individuals get back to achieving an athletic pelvis. Kate Taft, welcome to the Exploring Fitness Podcast.
Thanks, Dan.
Yeah. So, did I miss anything in the intro? Anything else you want to add?
No, that's pretty accurate. Besides hopefully completing my level 1 CrossFit certification coming up in the next month.
Sweet. Congratulations. It's
Thanks.
an excellent course. I think you'll enjoy it and learn a lot. First question I ask all of my guests. What is fitness to you?
Good question. Fitness to me is more about healthy habits and not something that should be like forced to do, but it's more of what is what I want to do. And fitness is, I think, more of just a combination of like not just physical fitness, but like mental fitness too. I think it's just just something that you do. It's to me has become such like an automatic part of my life, like brushing my teeth. And that's how I want like everyone to feel about it. But fitness in terms of more specifics is a lot of CrossFit, running, minimal amounts of yoga, just to get into the specifics. But it's definitely fitness is routine to me, and it's part of my weekly habits.
Nice. Love that. Routine of healthy habits that aren't forced and also include the mental aspect. Yeah,
Definitely.
great. So to start, For listeners who might be unfamiliar with pelvic health PT, can you kind of explain what exactly it is, who can benefit from it, those kinds of things?
Yes, so this could be like a 30-minute answer, but um, I mean, pelvic floor PT, I really feel like it should be relabeled pelvic bowl PT because the pelvic floor muscles are essentially this group of muscles that are within inside the pelvic girdle. There's several different functions of that, and they're not just related to bladder, bowel, and sexual function. I mean, the pelvic floor muscles are a hammock that sit underneath our organs. They're supportive for all the viscera. They are supportive of our skeleton. Um, the most basic functions of urination, bowel habits, and intercourse are essentially needing to go through those canals. But it also helps out with arterial flow too, just like kind of pumping the blood through our arterial and venous systems, like through the pelvic region. Um, it's definitely something that we use every day, not just with bladder and bowel issues, but like walking and coughing and sneezing um, and sleeping as well.
So you're saying that the contraction of those pelvic bowl muscles help with circulation of blood throughout the pelvis?
Yeah, and they can not just contraction, but in relaxation too is definitely important to like let blood flow through, but also push blood flow along too. There's kind of a unique diagnosis called pelvic congestion syndrome that actually is a result of dysfunction of what they call like the sump pump function of the pelvic floor. So just a lot of features I feel like that people don't know that the pelvic floor does outside of bladder and bowel issues.
Interesting. So what drew you to pelvic PT? Because according to what I said in the intro, you haven't done this your entire career. So, like, what kind of led you down this path?
Yeah, good question. I honestly, I feel like there's a little bit of I don't know if it's like selfish reasons, but as as a starting PT, I had an amazing manager, my first job, and I was doing mostly like orthopedics, a little bit of peds, and there was no pelvic floor in my first 2 years. And that manager kind of sat me down. He's like, I really want you to think about what you want to specialize in. Having a niche in any healthcare career can be very helpful for getting hired, longevity. You always want to have this like niche that no one else can do, or maybe no one else wants to do. So I kind of held on to that. And then I moved to Boston, took my first pelvic floor course, and I was like, I can do this. I can talk about this. I really like enjoyed it. I attended the like level one Herman and Wallace pelvic course, and I thought it was like excellent. The teachers were excellent. There was the class sold out very quickly. And really it just kind of cascaded from there. It was just a course I really thoroughly enjoyed, and I started treating those patients. I took more courses, added in that additional dynamic. Um, so there wasn't like one specific thing, but it was just like a genuine interest that really kind of propelled me to continue to do this and specialize in this area.
So it's kind of that first manager's suggestion of wanting to specialize in something, and it just kind of
Yeah.
snowballed from there.
Yeah, honestly, yeah, I think I don't know where I would be if he didn't kind of like nudge me into thinking a little bit more, because I think I would have continued to pursue just like a generalized orthopedic, career. But he got me thinking a little bit more of like, all right, I really need to think about like what I really want to do. And I thought that was very helpful.
What do you find most rewarding about working with these types of patients compared to like the general orthopedics that you started out with?
Making people feel comfortable. I think one of the most genuine compliments I've gotten, or gotten several times before, is just that you make this process seem easy for me, Kate. I mean, you have patients coming in and you're talking about the most vulnerable things. And I think so that's the most rewarding part, is like just getting that feedback and making the most uncomfortable topics of conversation more comfortable, and then establishing a plan of care for them that works for them.
All right. Well, let's get into some of those uncomfortable things. Like, what are some of the most common conditions that you treat as a pelvic health PT?
So if we kind of stick with some of the females to start, bladder issues. We have anywhere from urinary stress incontinence to urinary urge incontinence. Um, there can be urgency, frequency, individuals that are coming in with recurring UTIs, bladder infections. Um, there may be individuals coming in with interstitial cystitis, pain that's involved with like bladder filling. There could be pain with intercourse, pain with urination, um, pain even just in that area that's not necessarily provoked from intercourse or a vaginal examination, um, pain with piping, pain with bowel movements, constipation, difficulty with eliminating bowel movements, bowel leakage. Um, so we work really closely with like the proctologists, gynecologists, urologists, in terms of those um, referrals and all the tests and measures that go along with the bladder bowel issues. But some of the big complaints are constipation, straining, pain with intercourse, and then urinary incontinence. And then for males, I see a lot of males with like urinary urgency, frequency, testicular pain, pain that might be provoked that's associated with erection, and then also a lot of like accompanying back pain too. But we also see males that are associated with surgeries like having your prostate removed. There's a lot of urinary issues and incontinence surrounding that. It could be leakage or urinary incontinence with stress, coughing, sneezing, laughing, lifting, or also urgency as well. And I think the list continues to go on. Yes, kind of get my point. So,
So you covered a lot of different conditions there. Do you go about like treating all of those roughly the same, or are there like intricacies to each of those individual conditions? Like, can you talk about how you approach some of those things?
yeah, I think one of the most common like reflections that a lot of patients experience is that we do a ton of talking and education, especially on the first visit. It's not uncommon for me to like not even put my hands on a patient for the first like 45 minutes that we talk, or an hour, because it's really important to get a thorough um, explanation of like, tell me exactly about your bladder habits. Like, how often do you go? How much do you pee? Is there pain with urination? Where's the location of your urge? Is it at your urethra or is it at your bladder? Is it easier to stand to pee or sit to pee? More male questions. Do you have any pain with bladder filling? Tell me about your stream. Is the quality of the stream normal? Is there stopping, starting? Is there any hesitation? So we approach like in terms of maybe the first visit with a male and female, there's just so many questions to kind of go over, and then any like diagnostics they've have done. Um, but essentially there is like a few differences in terms of like the males and females, but we all have the same pelvic floor muscles. There's a lot of analogous structures, but essentially we all have the same pelvic floor muscles. There's no huge difference between males and females. I might ask them the questions a little bit differently, but essentially it is a very similar process that each patient goes through.
Cool. Um, you mentioned a couple already, but like, what are some of the typical signs and symptoms that might be present to let somebody know that they could benefit from pelvic floor PT?
Yeah, anything that is persistent or reoccurring, it's really easy for patients or individuals just to kind of ignore some of the symptoms that aren't persistent. And then they have a history of 10 years and poof, they're in pelvic floor PT. Um, but yeah, someone has persistent constipation, when I mean persistent, I think anything that goes on longer than like a couple weeks, um, straining with their bowel movement, if they have a lot of like urgency frequency, like if you're urinating more than every 2 hours for 2 weeks on end, that might warrant a referral. There has to be some normal pattern of bladder habit. Um, Recurring UTIs that are almost like monthly or once a year is even a little, it's just like too frequent. Um, Persistent pain with intercourse, even if it is positional, if there's only one position, it's still abnormal to have pain with intercourse. Or you go to see your gynecologist and you do experience pain every time. Or maybe you're one of those patients who are very avoidant of the doctors because of the discomfort and kind of fear. And one of the actually big diagnoses that I haven't even talked about is endometriosis. So having severe cyclic pain with your period, that can definitely warrant a referral. Those are the type of people who do have a lot of pain in that area, and usually there's accompanying pain with intercourse. Males, after might experience testicular pain after a leg day. It may be accompanied by also like lower back pain. Um, Males who notice any like tightness, or doesn't even have to be pain, but if you're experiencing any tightness even after um, a heavy leg day, or even after having an erection, it's just not normal. I have many males who I've met where they just ignored some of those symptoms, and then until they couldn't, it just ended up getting worse. They thought it was just kind of a normal thing that because it went away. But if it's causes discomfort, it's not normal though. Trying to think of other kind of presentations. Um, yeah, urinary leakage is a big one. That's not normal. Even the amount of leakage that happens after urination. So we call that post-void dribble. More than one drop would be abnormal if it happens, and that's a really common symptom I see males come in with. So
Yeah. And like that leakage is pretty common in the CrossFit space, right? With like double unders and box jumps and heavy lifting. Like, I think that it's gotten to the point where most people just feel like it's going to be part of their normal lives. Like, but like it doesn't have to be, right?
absolutely, yeah. It's important to figure out why the person's leaking. There's quite a few females who are maybe early 20s, have never had children, and they're still experiencing urinary leakage. I hear that quite often, and that could very much be a result of pelvic floor tightness. And so when the pelvic floor muscles are tight, doesn't mean they're strong. And it also means that they're probably not able to like optimize an effective contraction. When someone does 50 double unders in a row, or when someone does a WOD that is involved like rotating box jumps, or alternating with burpees, the amount of load that you put on your pelvic floor during a CrossFit class can definitely add up, and it doesn't always have to be due to weakness of the pelvic floor. It can just be due to a lack of. I always use a term like action potential. So the ability of a muscle to go from like kind of rest to like fully contracted can often be the most like biggest reason why they're successful in not leaking. Um, I have worked with a patient who is deadlifting well over 300, she was very strong, but her pelvic floor strength was nothing. It just wasn't there. And so like building that connection with the pelvic floor and optimizing the contraction can be very effective in terms of um, preventing urinary leakage. Of course, there's the other part where there is quite a bit of pelvic floor weakness. that may come postpartum, or in our older population, whether it's like 60s, 70s, and even 80s, there still can be improvement regardless of what decade of age you are. And I think some people forget or don't know that, like, there is an option out there. So
Yeah. So you said that some of these problems can be kind of like ongoing, chronic, recurrent, that people have dealt with for upwards of like 10 years before finally seeking help. Like, why do you think people are just living with some of these things? Like, is there a stigma, or what's the hesitation in seeking help for pelvic health issues?
good question. I think that with pelvic floor becoming more of like a common conversation within healthcare, I think that is leading a lot more to referrals. But there's some people who just what are treated, and they just reach a tipping point. They're like, I'm sick of this. For example, I have a lady who's in her late 50s, early 60s. She's like on the brink of retirement. So she's cutting down work. She's at home. She's exercising more, paying attention more to her body. And she's like, I'm really annoyed by this. And I think it could be the where you are at in your life. And I think she's just noticing more things about her body. So she told her doctor, and he sent the referral. Um, and it was just very helpful. Now she is like having significantly less leakage, but she's been leaking since she had her last child over 30 years ago. And so time can get in the way, um and life too, but it's that's a long time to kind of go without. If we did 3 months of pelvic floor training, like, I wonder how her past 30 years would have been, um, with the urinary leakage. So I think it's becoming a more common conversation, which is wonderful. But I also don't want people to um, make it a cool thing to do. Like, if you are symptomatic and you are, or even if you're curious, like, come in for an evaluation. But um, I always find, I don't know how to say this correctly, like, I don't want it to be trendy. I want it to be the norm. This is not a trendy thing. This would be a normal thing. And I think sometimes social media, like, makes it out to be like that. And it should be really a mandatory thing, like brushing your teeth, like fitness. So
Do you think it should be something like most people go to an annual checkup with their primary care provider? Should individuals go see a pelvic health therapist like once a year, just to make sure that there's nothing that they need to be working on to keep that area healthy?
yeah, I would love if people came in once a year, especially if there was like this checklist that people kind of ask themselves yearly, if there's any minor dysfunction, then the answer would be, yeah, like, come on in. Um, I would say absolutely for moms who are postpartum, within at least like 5 years of having like their last child. That should I should 100% should be once a year. But for if there was a checklist, if there's any symptoms that individuals are questioning, then I think, yeah, it would be great to have a yearly checkup with a pelvic floor PT for sure.
So if someone's listening to this and they're still, well, like some things are kind of like resonating with them, but they're still feeling hesitant, like, do you have any specific advice to that person that might be contemplating but is still kind of on the fence?
I would say, why not? Why not just give it a try? I think there are so many pelvic floor PTs out there, and I feel very strongly that it's important to connect and resonate with the right one. So, if you do go to a pelvic floor therapist and you're like, I just didn't like the experience, like, shop around. I think that's very important. I think people hesitate because of time, they're busy with their lives. But I think next thing you know, 30 years will go by and they're still suffering from urinary leakage. So I think the biggest is like, well, you don't want to do it because it's you shouldn't live a life of like abnormal bladder and bowel issues. So better now than, wait 20 years.
Yeah. Shop around. See Kate. Her
And
patient,
yeah.
her patients say she makes it easy.
Most of them, yes.
So you mentioned how like awareness of pelvic health therapy has been kind of increasing in recent years. Like, how do you see pelvic health PT kind of evolving in the coming years, like as awareness continues to grow?
Yeah, the I find more and more patients are referring or asking their doctors for referrals. So which is great because with social media and being able to Google everything, I mean, we're dealing with the most like educated patients as healthcare providers, and I think that's really important to remember. So, like when those patients come in, um, I think we almost need to, at least as healthcare providers, need to be like on top of it. There with our examination, our education, but in terms of like where do I see that process going, I really hope it continues to grow in like social media and the news, and it's just people are now they don't ask like, oh, what's pelvic floor PT, or I've never been to pelvic floor PT. Now it's like, oh, I haven't been to my pelvic floor PT in a year. I need to make an appointment. Just like I haven't seen my primary care or haven't seen my gyno, or I haven't had my hair cut in 6 months. Like I haven't seen my pelvic floor PT in 6 months. I feel like it will start to become a lot more normative the more that we share. And I think that's a very like wonderful, wonderful thing.
Are there any like exciting advancements in research or tech that you've seen over the past 7 years, or that you've heard about that might be like coming up in this area?
So I really enjoy working with ultrasound. So ultrasound is a way to externally look at pelvic floor movement. It's a really nice adjunct for individuals who are very much not willing or not wanting to do any like internal examination. So providing some type of feedback with this ultrasound, and it's ultrasound that you can use trans-abdominal or trans, so over the bladder or over the abdominal area and over the perineal area. And I feel like that has been a very exciting area for pelvic floor therapists to utilize these imaging techniques that are not just images, but it's real-time movement that can provide awesome visual biofeedback. And that's like one of the highest learning types of feedback we can have that really allows for like buy-in, but also you just feel good about what you're able to like learn and produce and just like really create that like mind body connection of like what your pelvic floor is doing. I can see why in more pelvic floor PTs would continue or buy ultrasound and use it, because it is very, very, very helpful for males, especially too. And when we do examinations, we cannot do obviously a vaginal examination, and so sometimes it's really nice to be able to use this uh, ultrasound to take a look at the pelvic floor muscles, to take a look at urethral sphincter muscles, just to make sure we give them the optimal feedback without doing any like internal manual work. So, but yeah, that's my like favorite that I think is when you're looking for a pelvic floor PT, ask that clinic, do you guys use ultrasound? And I think that would be very optimal in terms of someone's learning experience when they see a pelvic floor therapist. So.
Yeah, and they need to understand that there's a distinction between uh, therapeutic ultrasound and diagnostic ultrasound. You're talking about
Yeah,
diagnostic ultrasound, which
correct.
is
Yep. Yeah.
more similar to like a sonogram that somebody gets whenever they're pregnant.
Yes,
Yeah,
exactly. Yep. So
yeah.
exactly.
I was at a workshop that you did previously, and you had your diagnostic ultrasound, and I think you were looking at like the diastasis recti on somebody, which I
Yes.
think is something that we haven't even mentioned yet. Like, so can you dive into that a little bit? Like, do pelvic health PTs help with those kinds of things, like diastasis recti in postpartum individuals?
Yes, that's definitely a very common worry postpartum, is the quality of the abdominal muscles, not just for aesthetics, which is totally fine if someone wants to come in and work on the aesthetic of their abdominals, but it's the amount of like strength and force pressure that can be put through the abdominals without causing that separation, like along the linea alba line. So providing feedback and just personalizing someone's core workouts with the diastasis diagnosis. I feel like that's what pelvic floor PTs are like really good at. Because I mean, remembering that PTs, pelvic floor PTs, did go to school to be specialized in like exercise science essentially, and so we're very good at training muscles. And what's the pelvic floor muscles or the abdominals or the hamstrings, like that is our like meat and potatoes of like of what we do train. But we definitely do assessments of there, and then the ultrasound for diagnostics can provide also this kind of real time measurement of how far or yeah, how far basically the separation is, and then using that measurement as a means of, all right, is it wider or is it brought back together when you're in a plank or when you're a sit up or when you're doing um, hanging from the rig and you're doing knee raises. Those are like really, it's really helpful diagnostics where you can actually create this objective measure of like your rectus abdominis that's either coming apart or pulling together during certain movements. So it's a really nice way to personalize and give feedback to our moms postpartum, but also our males too. Any large male large abdominal who may have what kind of look like this hernia. I put that in the diastasis category. Some males will come in with just like abdominal pain, and we can kind of work with that as well and treat them very similar. Just trying to kind of come up with this like personalized fitness routine that minimizes that abdominal separation too.
Interesting. And just clearing up a couple of terms for our listeners, Kate mentioned a couple of anatomical things. One being rectus abdominis, which is the abs or abdominals, right?
Your six pack
And then
abs, if you want to, yeah.
your six pack abs, yes.
Mhm.
And then the line that runs from the center of your kind of like the bottom of your rib cage down the middle of the six pack, that would be the linea alba, which is essentially like a tendon kind of holding the two sides together, right? And that's where the separation happens for diastasis recti.
Yes.
Yes. Okay. Just clearing that up in case people weren't familiar with those terms.
Yes.
But guys can have that too, even if they haven't carried a child.
Yes.
Interesting. Are there exercises or like some self-care strategies you recommend to people to maintain their pelvic floor health? Is it all about
Yeah.
the Kegel?
It's not all about the Kegel.
It's not all
No.
about the Kegel. All right. What is it all about?
Optimizing your range of motion. I mean, think about any other muscle like hamstring. We don't want them to be just strong and tight. Like we do have to work on flexibility and then eccentric loading. Like what the heck does that mean for the pelvic floor? So a lot of breathing is just like a very good place to start. Lower abdominal breathing can help to kind of lengthen that pelvic floor during the inhalation, and then during the exhalation helps to kind of recruit and shorten the muscles, and being able to like essentially feel that whether it's internally or measure or observe at the perineum. That's the area essentially on a female between like the vaginal opening and the rectal opening. But a lot of like deep belly breathing will help to like gently lengthen and then contract the pelvic floor muscles That's a good place to start. And then,
Yeah, because
of course,
it's supposed to naturally move as we breathe, right?
yes. Yep.
Yeah. Okay.
Definitely. Then we can like make that movement bigger by making more active movement. So exhalation and then doing a Kegel at the same time. So that's a pelvic floor contraction. And then as you inhale, your pelvic floor should kind of lengthen. You could always like do a gentle bearing down to optimize that range of motion. That's the type of stuff I like to work on for moms who are preparing for labor. Just like really getting nice and strong in that like breathing, possibly hook lying position, laying on your back. But then not just Kegels. I mean, adding weights to our body. When we add load to our body, you're going to add load to every muscle that like absorbs it. So, when we do a deadlift, we do a farmer's carry, my argument would be that's a core exercise or that's a pelvic floor exercise too, because you're adding load to those muscles, which is genuinely very important to work on pelvic floor strengthening, to work on core strengthening. It's not just about Kegels and it's just not about sit-ups. Those are like very isolated contractions of those muscles. Um, but they're not the only thing. So for someone who wants to work on pelvic floor strengthening, you can't just do Kegels. You definitely have to have a consistent load exercise that you're doing, whether it's body weight exercises, body weight step ups, or you're taking up a notch and you're doing a clean and jerk, or you're doing deadlifts.
So I'm guessing that kind of stuff can help with like overall athletic performance, right?
Definitely. Going back to like one of the functions of the pelvic floor muscles, that they do help to keep the pelvis together. I mean, if you were to like look at the anatomy of it's just the soft tissue structure helps keep everything together. So it doesn't have to just like rely on the ligaments and tendons that are within the body. You have your pelvis, which is essentially made of 3 bones. You have your right side of your pelvis, your left side, and then your sacrum. And those are all like put together by really tight ligaments, but right in the middle and the bottom is your pelvic floor. And so it can be very important to like stabilize during any asymmetrical movements. So lunges, a clean and jerk with anything like overhead, any step ups, yeah, lunges, but of course, like squats in general too. It has to be able to like stabilize your pelvis and hold it together.
Yeah.
But,
So
but
basically,
yeah,
like any movement where a
you're
coach
upright.
in class, or like any movement where a coach in class is saying like make sure that you're keeping tension like during whatever pull-ups or rig work or heavy lifts, like that's going to involve the pelvic floor as well.
100%. Yes.
Yeah. Cool.
Has to.
Has to, or else you're going to leak.
Or else you could experience pain because of lack of stabilization. So not necessarily leakage, but it could result in just like prolapses, leakage, pain due to instability. But you could, if you don't contract your pelvic floor muscles, then you're putting the stress on some other structure, and that's going to be your tendons and ligaments. So that can just lead to other problems.
Yeah. So everybody work your pelvic floor.
Yes.
Awesome. Any other thoughts or parting words for our listeners today?
I mean, as much as we don't want to encourage Dr. Google, like Google and come to your pelvic floor PT with questions. It's important that you are educated and that you know as much as possible about your own body. And so I love when patients come in and be like, well, I read this, I read that. I'm like, this is why this is correct, but this is why this is wrong. And I always just like to tie it together. So but yeah, ask questions, even if it feels uncomfortable. It's your body, and it's really important to take care of it. So just because your doctor didn't ask the question doesn't mean it's not important. So that's
Other
been
than Dr. Google, Are there any other like good resources that you would recommend for people?
Any there's so many. But I really like Herman and Wallace. It's an institution that provides a lot of clinical education for PTs. But on their website, they often have a lot of resources that people can look at for studies, case studies that's related to pelvic floor or for males and females, whatnot.
Cool.
So
I will link that website into the show notes so that people can find it if they're interested in that. I will also link a kind of like checklist questionnaire that we have on the Infinite Capacity website with typical potential signs and symptoms that can kind of let you know if you would benefit from pelvic floor PT. And is there any way that individuals can get in touch with you if they want to discuss any of these things further?
yeah, you can add my email, my Gmail that you have on
Perfect.
here, and then if people can reach out with any specific questions, if I didn't mention a specific symptom and you have a question about it, I highly encourage anyone to reach out.
Wonderful. I'll put that in the show notes as well. Well, Kate, thank you for hopping on here and talking to me about this delicate but very interesting subject. You're a wealth of knowledge about it. You can tell that you spent 7+ years in the field doing this.
Thank you, Dan.
You make talking about it easy.
I hope so. That was my goal.
Cool. All right. Thanks again, Kate.
All right. Thanks, Dan.